May every year marks Stroke Awareness Month. And during that time, we get out into the community, we educate the residents, the emergency medical services, the providers about the signs and symptoms of a stroke and what can be done in a time-sensitive fashion to save the outcomes of your loved ones. It has never been more important than now to reinforce the importance of coming to the hospital, recognizing the signs and symptoms of a stroke, calling 911 immediately, and not delaying timely care. Patients that previously are coming in paralyzed, unable to talk, unable to understand what others might be saying, we have treatments that are revolutionary, advanced over the last 8 years that can be night and day for the patients and the families. So previously, prior to the pandemic, our volumes, as Dr. Katz remarked, we were seeing upwards of a dozen stroke alerts come in per day. That volume steadily declined through mid to late March, and patients were eventually coming in, but to the point where it was too late to do anything out of any urgent, emergent treatment windows. And it is indeed very heartbreaking to see that. So what I really want to explain to the community is that we're ready. We have all the safety protocols in place. Anytime a patient comes into the hospital via the emergency room, via triage, all of the protective equipment is available in place to protect the staff and the patients. And time is of essence. We get the patients to the cath lab immediately. And as Dr. Katz said, time is brain. Every minute matters. Emergency medical service providers from Pines and Miramar, we work with them closely with in-field stroke protocols to ensure that they also recognize signs and symptoms of a stroke, and we activate our cath lab as early as possible due to their pre-hospital stroke alerts. So the time-sensitive treatments, the clot-busting medications such as IV TPA and mechanical thrombectomy in the cath lab are paramount. That is what we can still offer to the residents of our community. And so I understand the fear might be there, but we just want to reassure you that you're better off coming to the hospital and seeking timely care rather than delaying it and then having a bad outcome. So thank you for the opportunity. Appreciate it.